Welcome back, everyone. President Biden, the First Lady, Dr. Anthony Fauci, and Late Show host Stephen Colbert all tested positive for COVID-19 a second time after taking the antiviral therapy Paxlovid. So how common is a Paxlovid rebound? In today's Health Minute, Mandy Gaither has a look at what researchers have to say and why health experts believe Paxlovid is still a good treatment option.
It's an antiviral pill used to treat COVID-19. As of mid-August in the U.S., the Department of Health and Human Services says about 4 million courses of Paxlovid have been administered, but some people who have taken the antiviral pill are testing positive a second time.
We know that people who are older are more likely to rebound.
Several studies have tracked rebound cases, including a preprint study that looked at cases during the Omicron wave. It found 2 to 4% of patients experienced a rebound infection or symptoms within a week after treatment. 5 to 6% had a rebound within a month. Experts say that rebound cases are probably more common than data shows, but by how much is hard to tell.
But at the end of the day, the rebound, none of the cases that have rebound has ended up having more severe disease or ended up in the hospital. So I still think Paxlovid is an incredibly useful drug.
That's why experts say overall, Paxlovid is still a good option for treatment for people over the age of 65, those who are immunocompromised, or adults who have underlying conditions such as diabetes or heart disease. In a statement, Paxlovid manufacturer Pfizer said, while further evaluation is needed, we continue to monitor data from our ongoing clinical studies. We remain very confident in its clinical effectiveness at preventing severe outcomes from COVID-19 in patients at increased risk. For Health Minute, I'm Mandy Gaither.
Now, both President Biden and Dr. Fauci received a second course of Paxlovid to treat their rebound cases. The FDA has requested more data from Pfizer to study patients who may need a second course of the treatment. There's some thinking that patients may need to take Paxlovid longer, and the FDA is definitely looking into that.